So, as I'm sure you know, there's been much debate about whether South Africa's communication on the newly discovered COVID-19 Omicron variant may have set the country up for unending scrutiny. It was on Thursday when the Health Ministry announced that the variant of concern has been detected in South Africa. Scientists revealed that Omicron has 30 different mutations with concerns about its transmissibility and whether current vaccines would actually be effective against it. The United Kingdom, as well as several other countries, subsequently imposed travel bans on several southern African nations. The question now, amongst many, is South Africa being punished for its transparency in communicating with citizens and the global health communities about this latest discovery? To help us worm through these murky waters, let's bring in public health medicine specialist Dr. Lehlohonlo Mjake, who joins us now via our video link. And Doc, it's great to see you. Thank you so much for making time for us here on the Weekend Report. I wonder whether the kind of precedent that's been set here is a worrying one, insofar as what the response to our scientists announcing this variant has been. How concerned are you that in the future we may very well see countries actually withholding this information because they actually don't want the response that South Africa has been dealt over the past 48 hours?
Okay, very good morning, Ayanda. Thank you for having me, and morning to the listeners. From our perspective, I think South Africa announcing its new variant, which is the Omicron variant, was a responsible thing to do. When you belong to member states, because remember, we are governed by global bodies as various departments of health. And once you're a WHO member state, you need to abide to their regulations as well. And so the international health regulations is such that we actually need to report. It's our duty to report whenever we have a variant. So has South Africa done the wrong thing by reporting it? Absolutely not. I think it needs to be applauded actually for alerting authorities, relevant health authorities globally, that look, we have discovered a new variant. Would this most likely make other people err more towards not reporting it? I highly doubt it, because I think we need to understand that health is a lot about ethics and ethical behavior. And you can't hide something like this, because at some point, if a retrospective analysis are done, will be discovered, which will certainly not bode well for any country to do that. So I don't really think that it is a bad thing that South Africa reported. And I also think that there's a lot of hype in the media about the response by the international society towards this. But remember, at the end of the day, every single Ministry of Health is actually responsible to ensure that it mitigates spread of disease and it protects its own member citizens. And so perhaps we also need to just really respond to what may seem like an exaggerated response with far more empathy. But also, Ayanda, just in closing on this point, is that, remember, South Africa is the one that actually said to WHO, we have discovered a variant, and we really think it ought to be classified as a variant of concern.
Interesting, one of the statements you've just made, that health is about ethics. That may be true, but pandemics, it feels, are about ethics, the economy, politics. And, you know, over the past couple of days, we've seen really the intersection of all those things, resulting in the kind of behavior that has been criticized in some respects. What role does something like the WHO have to play in that world, outside of making just an appeal that countries shouldn't be hasty in their response? In other words, could this moment potentially reveal the WHO perhaps as being a dog with no bite, and understanding the role that they have to play also in the world?
No, absolutely not. I think what we need to understand is we've got various bodies that deal with various things. You've got your WHO for health, you've got your DIRCO for international relations, rather. And so I certainly do not think that WHO would be a dog without teeth. The mere fact that the world is actually cognizant of this infection and is dealing with it in the best way they know how really shows that WHO is an integral part of communication when it comes to health and health-related matters. And another thing is, I just think because there's very few that's still known about the specific variant, the scientists are working around the clock to understand it, understand all these mutations, understand the impact it has on the various vaccines that we have, and the possibility of boosters. Other countries really are just buying themselves time, and rightfully so, to get to understand just what it is that is taking place. We've heard that, you know, it has an ability to spread far more rapidly. And of course, we know that when you're looking at the aviation industry, where you have about 2.4 billion people, traveling around the world in a very short space of time, we need to really be cautious with regards to how we manage, various things that can really impact on the globe in a matter of hours. And I think this is how the public ought to really look at it. When it belongs to you, because of currently it's associated with South Africa, it's highly easy for us to get emotional. But I think we need to look at the science behind it and be responsible citizens as well with it by doing our best to make sure that we don't spread it any further.
Right. Speaking about the science behind what we're seeing take place, I mean, time has lapsed, and we understand COVID better now than we did at the start of the pandemic. I think it's safe to say that. Given that knowledge and the benefit of hindsight, how impactful really is something like a travel ban in a context where already we've seen other countries also detecting cases of the Omicron variant themselves?
So COVID being a infection that spreads via contact and certainly via, all kinds of modalities of transportation, a travel ban for me, I would say, is definitely effective. When you look at your various ports of health, whether you're looking at the sea, ocean, road, and so forth, it is the responsible thing to do. And in actual fact, screening really should be at its utmost efficiency at this moment in time. What is important is we need to start getting communities to be at a point where, Ayanda, if I ask you, Ayanda, have you been vaccinated? Ayanda, when last did you go to a party? Are you hosting this Christmas, Ayanda? You ought to be confidently answering questions in such a way that you're not contributing further to the spread of this infection. Government can only do so much. International bodies can only do so much. We get given information as well. We also need to start adhering and, responding in the best way to protect ourselves, our families, and those around us.
Yeah. Speculation mounting that amongst some of the measures that the government may respond with now that there's this mutation is something along the lines of a mandatory vaccine regulation, mandatory vaccines being instituted in various respects. Something like that, as a public health medicine specialist, do you think it would work?
As a public health medicine specialist, our duty is to really educate individuals, communities, on various things that have an impact on their health negatively. We need to promote health. And of course, at the same time, we want to try and mitigate any spread of any disease. Why do we want to do that? So that we can have a healthy society that can contribute to the economy and continue living normally. And so at this moment in time, we've seen that the traction from voluntary vaccination has been very slow for various reasons. Access being one of them. Not being able to drill down and go right into the heart of the most informal settlements, through your ward-based outreach teams and your community health workers with nurses in charge to really go actively vaccinate, as has historically been done with other extended immunization programs. And so there comes a time where if society is very doubtful of the signs that we're giving, we need to give that additional nudge. And I think, calling it involuntary vaccination, for me, I would actually say it is really an involuntary, an additional nudge that we actually give into society. And it would really be the best because we've seen that those who've been vaccinated have far more milder symptoms as opposed to those who haven't been vaccinated. So I think it would be a step in the very right direction.
Sure. Let's speak about what we are seeing despite how little we know about the variant in and of itself. I mean, there have been some doctors who have come forward to relay how seemingly those who are coming forward with this variant aren't actually presenting severe disease. Is that something you're able to speak to at all?
So for me, when you're dealing with a country of 56 million people, you're dealing with 6 million individuals who we know of that are HIV positive. You're dealing with a community that really has challenges with regards to space and infrastructure. Due to various factors, of course, poverty being one of them, that result in informal settlements. You're dealing with a population that has severe communicable disease, non-communicable diseases, obesity, diabetes, and cancer. We really have a responsibility to ensure that we give ourselves time to study the facts and also use a big population. It's one thing to have your own practice somewhere in the corner that may see, 40 people in a day, 40 people who have access to medical aids, and so those are people who are definitely on a higher socioeconomic status and have got their diabetes in check. They have the best ARVs, so they're fine. versus when we look at the rest of the, but 99% of the country where we're not sure what's going to happen with this virus. I think we really need to be cautious about that, and I also think we need to really guard against mixed messaging. I think we need to wait for the scientists. The scientists are working around the clock. The scientists are still going to say this is what we have discovered about this virus, and more bigger role will come from bigger bodies that actually treat huge numbers that will say this is what we have seen. Certainly, currently we are seeing milder symptoms, but if you're seeing people in private sector, these are people who've got access to healthcare. Yes, in state as well, there's been reports of the symptoms are milder, but also health-seeking behavior. The people who probably go there might be the ones who go there much earlier. We don't know about the ones who are struggling at home, didn't get vaccinated or got vaccinated, and, for them, they didn't get to the hospital on time. So the message to society really needs to be consistent and it's clear. COVID-19 really is an infection that very few of us know about clearly. Every time we think we've actually understood it, new variants come on place. It is a killer. If it actually gets into a human body that cannot handle it, and you don't want to really be doing social experimentation. Rather do the right thing. Get vaccinated and wear your masks.
Sobering reflections as we continue decoding what we know from what we don't. Thank you for your perspective. Appreciate your time. Dr. Lehlohonlo Mjake is a public health medicine specialist joining us there via our video link. Once again, thanks very much indeed.